Hello guys, my name is Aline, I'm from Porto Alegre, and I'd like to summarize this case and to share some of my thoughts about it. Professor Lombardi is a pulmonary physician that is trying to test a new drug for exercise-induced asthma. He has limited funding for this study, and he believes that a study with 60 patients would already demonstrate some difference between the new drug and the placebo. He's planning to compare the new drug against placebo, but without patients receiving the standard treatment. His main concern about it is which is the best randomization method for this small study. We all know that in small samples, randomization method could be problematic because if the final result of randomization is two different groups that cannot be compared, that they are not equal, there will be a sampling bias, and no statistical techniques could fix this error. Equally, allocation concealment failure could lead to selection bias and compromise the results of the study. The simple randomization is easier, cheaper, but in my opinion, it's not an option because in small samples, the imbalance would be likely. The other option, he should consider to use the minimization method because despite of being expensive and burdensome at the beginning, this will probably guarantee an adequate randomization with no concerns about unblinding, since the allocation of the next subject will have greater probability to be in the group with less participants. And with this method, he can use the number of strata he desires because he believes that this new treatment response will be affected by some covariates and baseline characteristics. With the right personnel, with a statistician and a computer science expert, he can use this method and adjust the final statistical analysis. So this is my opinion about this case, and I shared it before in River, and I hope you like my comments. Thank you.